Hi, it's Ken Hale one more time with a video update from our Introduction to Pharmacy MOOC for week 7, our final week of the MOOC. This week in which we're studying the contemporary issues and the future of pharmacy is actually spring break at Ohio State University. We are not having classes. Many of our faculty, staff, and students are actually away from campus, and I'm going to be one of them. So I'm going to confess to you that I'm recording this video prior to when you'll be seeing much of the content for the final week. We're recording this as we prepare to launch week 7. But I wanted to take this opportunity to get in front of you one more time to highlight certain things that are being studied in the week to come, and also to bid you well. So let's think about what's happening in week 7. We're studying contemporary issues in the future of the field, as I said. In the content videos, we're going to be looking at very important topics like provider status for pharmacists, telemedicine and telepharmacy, personalized medicine and pharmacogenomics, changing workforce issues, something that students who are thinking about going into this field certainly are interested in. And then a few kind of thoughts about the future of the field from some very important people. Some of those people are going to be in front of you in our guest practitioner interviews. These are leaders in institutional practice, in our national pharmacy organizations, and in our faculties. So I really encourage you to take a look at those guest practitioner interviews if you haven't done it. They will give you some insight from a very personal standpoint as to how this profession is evolving and where they seem to think it's headed. Our pharmacy fundamentals this week, there are only a few of them, 6, but I think they're pretty powerful. The first 2 are going to deal with personalized medicine and pharmacogenomics. That's a very important contemporary issue and terms. Going to learn more about the Pharmacy Workforce Center. Provider status, probably one of the most important pharmacy fundamentals of our whole course. This is recognition of specific health professionals as patient care providers in the U.S. Social Security Act, which is required for reimbursement under Medicare. Provider status, as you will learn or have learned already, is something that could really change pharmacy practice, and our national associations are investing a lot of time and money to really try to make this happen, because it could change not only for Medicare, but for how we practice with all patients in the United States. And then the whole idea of telemedicine, telepharmacy, the latter being the use of telecommunication and information technologies to provide comprehensive pharmacy services at a distance. You know, these are really kind of futuristic ways that are really happening now in terms of how we're going to deliver health care through mobile health, through telehealth, telemedicine, telepharmacy. I think we may or may not like this concept, but it's here, and we need to really think about how we can fit into that scenario. I've given you a couple web resources to learn more. One of these is a link to the American Society of Health System Pharmacists initiative they called the Pharmacy Practice Model Initiative. Very important initiative to really think holistically in the United States among our institutional pharmacy practitioners about where we want to establish the practice of the future and what should the standards of practice be around that practice in the future. So that will really give us a close look at kind of institutional changes and where we're headed. I've given you a link to the Department of Health and Human Services Health Resources and Services Administration Bureau of Health Professions, it's a big long title, Adequacy of Pharmacy Supply Document 2004 to 2030. This was published in 2008. As we think about workforce, we'll find that the supply and demand seems to be kind of equilibrating, but there are a number of groups like this one and like the Bureau of Labor Statistics that you'll learn more about if you haven't already. Will tell us that there is a bright future in terms of the need for pharmacists, but we need to think strategically about how we position ourselves for what those needs of the future are. And in a nutshell, it's patient-centered practice, it's medication therapy management, it's provider status, it's primary care provision. These are the things that we need to be preparing ourselves for in the future. I've also mentioned to you in the videos and posted to our website 2 documents that may be of interest to you. The first is called Improving Patient and Health System Outcomes Through Advanced Pharmacy Practice, a report to the U.S. Surgeon General 2011. This is a really key document that very succinctly outlines what the need is for different kinds of pharmacy services and what evidence we have that they are providing that need now and prepared to provide more in the future. It's a good kind of case being made for how pharmacists might be used more strongly in the United States. And then finally, a short document on pharmacy principles for healthcare reform. This was done actually in 2009. but is being used by our national associations as key points that our legislators need to be aware of as they reform our healthcare laws in the United States. It's obviously important. Well, I want to remind you that your peer assessments for our one written assignment are due by 11:59 p.m. Eastern Standard Time on March 14th. So please meet that deadline. And then, if we think about the future vision of pharmacy practice, one of the key issues we've been thinking about this week, I want to kind of revisit one more time this future vision document by the Joint Commission of Pharmacy Practitioners. I pointed this out in the videos, but let me just say once again some of the things that they've predicted. One, pharmacists will be the healthcare professionals responsible for providing patient care that ensures optimal medication therapy outcomes. So pharmacists will be responsible for providing patient care and for the outcomes that they produce. That pharmacists will have the authority and autonomy to manage medication therapy and will be accountable for patients' therapeutic outcomes. In doing so, they will communicate and collaborate with patients, caregivers, healthcare professionals, and qualified support personnel. That sentence says a whole lot in terms of our standing as a profession, in terms of autonomy, in terms of responsibility. It talks about our management of medication therapies and responsibility for their outcomes. And it talks about collaboration with all sorts of players in this healthcare team, including our technicians and our other colleagues in the healthcare team. And the last thing was that pharmacists will achieve public recognition that they are essential to the provision of effective health care. This is what the Joint Commission of Pharmacy Practitioners, this group of 11 national associations, believe. This is where they believe we are headed. So, the future looks bright, and I think, it's changing in terms of the workforce and the things that pharmacists do, but I'm really envious of those of you who might be entering this profession. I'm toward the tail end of my career. I think that the profession that you may be entering is really a much brighter one and has much more powerful potential than the pharmacy profession I entered earlier in my career. Well, as we conclude our MOOC, I want to give a few thanks. I owe thanks to a variety of people at Ohio State. One of them is our OSU Media Services Group, which produced many of the videos that we've watched throughout this 7 weeks. I want to thank Tom Evans in our Office of Distance Education and Learning, who has helped lay the framework for this course from the very beginning. I want to thank our teaching assistants, Jason Anderson and Madhuri Samaraju, who have been so helpful in this course, and I know that they've been with you in the discussion forums, and they've helped us immensely. I thank them for their help. Emily Keeler, who's sitting behind the video camera as I speak. I could not have done this without Emily. I'm being quite honest. So I thank Emily so much for her work. She's been very helpful to you. She's been very helpful to me. I especially want to thank our wonderful students. I mean, it's been a real pleasure to be with you, students around the world. So, I'm so blessed in my career to be able to interact with you in this way. So thank you for joining us. We've talked about the future of pharmacy. I hope you've learned a lot about the past, present, and future of this field. I hope that the future is bright for you. Eleanor Roosevelt said that the future belongs to those who believe in the beauty of their dreams. I hope that you dream big. I hope that your dreams are beautiful, and I wish all the best for you.